That's what's in this budget that passed the House of Representatives. But there's also other provisions in the budget that passed that would prevent the federal government from carrying out its current laws. It couldn't enforce the Clean Air and Clean Water Act, and it would repeal the health bill passed last year, signed into law in the last Congress. Now, that is done by two separate bills. One is the bill that passed the House of Representatives that repeals the law. The second is that they have prevented in the budget that passed any money being used to implement the law. Now, what does that mean for our seniors? Well, for our seniors, it means that the improved benefit for those who fall into that prescription drug coverage gap, known as the donut hole, which is worth about $500 for seniors who fall into that gap, they would lose that benefit. And there are seniors in Baltimore County, in our community today, that have a difficult time paying for their prescription drugs. Today, in Towson. And we can give you chapter and verse. I'm sure you've heard about here at Cardin. That would be lost. And by 2020, we close the donut hole completely. That would be lost if the repeal goes forward. There's a provision in the new law that provides for an annual wellness exam, annual physical for seniors, covered under Medicare. That would be gone if the repeal goes forward. The Medicare Trust Fund is extended for additional 12 years. The solvency of Medicare is critically important. There are those who want to privatize Medicare. There are those who want to give you a voucher, a dollar voucher, and then tell you to go out and buy private insurance. That's an active proposal in Congress. And they say, look, the program's going broke, therefore that's all we can do. Well, what we did last year is extend the solvency of the Medicare Trust Fund by 12 additional years. That would be lost.